Welcome back to Who Are You Now? This is my conversation with Dr. John Alevizos, and today we're diving into the hormone conversation. What's really happening under the surface of midlife, and why so many people feel off but are told their labs are normal. We'll explore how to approach hormone testing, the difference between estradiol and estrogen, testosterone's role in women and men, and how inflammation and lifestyle can either support or sabotage your results. If you've ever felt dismissed, confused, or overwhelmed by your labs or symptoms, this episode is for you. Before we dive into the hormone specifics, I'd love to start with your process. When someone comes to you not feeling themselves, what do you look for before diving into treatment?
Very good question. The whole reason they're coming to me is because they don't feel right. So before I see them, you got to order the correct labs. And when I meet a person, I say, how can I help you? How's your sleep? How's your weight? How's your energy? Then we look at the labs and see if those are congruent. 95% of the time they are.
So when you do your lab orders on new patients, do you run the basic lab panels and then also specific hormone panel?
Those are the hormone panels I run: estradiol, progesterone, testosterone, thyroid, and vitamin D. Look, if people are afraid of their adrenals and they want me to check cortisol, yes, their cortisol is high because there's a triangle between our thyroid, our gonads, and our adrenal glands. So if the thyroid is low, the stress hormone gets kicked out. You don't sleep, you gain weight because cortisol gives you truncal obesity. And you can't enjoy life when you're always scared that the bad guy's going to get you. And that happens 24/7 to make up for lack of thyroid or lack of testosterone estradiol. Testosterone estradiol is you get up and go, and conquer. Progesterone is, okay, go to sleep, relax, because tomorrow you got to go conquer the world again.
Right.
So in all of those, and vitamin D is the door that lets all these nutrients into working muscle, brain, heart cell. So people who have low vitamin D levels, their cholesterols are higher because the cholesterol is fat soluble, has to occupy the cellular membrane where the vitamin D would be. But overview, if we have the hormones we had when we were 25, we're going to feel like we were when we were 25, where you can raise children, go to work, take care of your household, go shopping, make dinner. So when we have youthful level of hormones, we feel like we're youthful.
Sure.
And I got to get something out of the way right now. Hormones and cancer. There's no such thing as estrogen. It's estrogens, 3 of them. E1 estrone, that's what causes cancer. E2 estradiol and E3 estriol prevent cancer. 100% of the estrogen dominant breast cancers are E1. Okay, so this is not something, we're giving something that prevents cancer, not causes it. And if it's at the 25-year-old level, you'll be able to make more human growth hormone, keep all your arteries open, which is the reason women outlive men in every population in the world. Men get their estradiol from our testosterone.
So if you're prescribing estradiol, right, which is, it's the
anti-cancer that opens up your arteries, and the more estradiol you have, the more human growth hormone you make, the longer you live.
With estradiol, is there the same contraindications for a cancer patient or someone who has a breast cancer history?
Wow. You're very intelligent. Okay. 2 different patients, both with breast cancer, both in their 50s, and then they got breast cancer. One went to UCLA, one went to USC, top places in the world. So I called a month after her surgery, my one patient. I go, give me your oncologist number. It's a woman, gynecologic oncologist, so only for gynecological cancers. So I go, hi, John Alevizos, our mutual patients needs bioidentical hormones. She goes, go ahead, give it to her. Just make sure the estradiol is topical. Now, oral estradiol is natural. It's bioidentical, but a small smidgen of it, around 1% to 2%, can be converted to estrone, E1, and that's what causes cancer. So either a patch or a cream every day. UCLA said, go ahead and give it to her. The other one went to USC. Our mutual patient needs bioidentical hormones. She says, doctor, she's estrogen receptor positive. I go, I know. Which estrogen? There's a pause. There's a sigh. She says, I know, but my board won't let me do it. I go, thank you for being honest. Because the general medical community think it's just estrogen.
Right.
They don't break them down, even though the pathologist, and if you want, God forbid you had breast cancer. But remember, vitamin D of 65 is a 67% reduction in breast cancer. So some of my patients, right after breast cancer, that are bioidentical hormones, the majority of them have to wait 10 years.
Wow. Okay.
And they say, I feel awful. And I can't believe these doctors are doing it. I know they're wrong. But if I don't get an okay from their oncologist. Because the reason is this. Breast cancer, you can get rid of all of it, and within 10 years, it can appear somewhere else. We have no idea why that happens.
And that's not necessarily because it went into the lymph system.
No, because the lymph nodes were all negative.
Oh.
I know it makes no sense whatsoever. Progesterone is the most anti-cancer hormone a woman has. It prevents breast, uterine, ovarian cancer. People with metastatic ovarian cancer can be on progesterone to decrease the progression of it. So,
is that a common practice?
Oh, not common at all. Estradiol and progesterone especially prevent cancer.
So progesterone, what are the normal ranges of progesterone?
Sure. So if a woman is having a regular menstrual cycle, she's not postmenopausal or perimenopausal, I'd like to see her draw her labs day 21 to 30 after her period. On blood test, they should be between 10 and 20. And women in their late 30s and early 40s are progesterone deficient.
Is there anything else about progesterone?
A woman needs to release melatonin so she can sleep. The first night she'll sleep like a baby. A woman needs progesterone to release serotonin. Those are the antidepressants Prozac, Luvox, Paxil, Zoloft, and Lexapro. A woman needs progesterone to release GABA. GABA is the Xanax, Ativan, Klonopin. Now, the majority of women that come to see me are estrogen dominant. If you Google estrogen dominance, weight gain, fluid retention, emotional liability, no sex drive. Estradiol causes the uterus to feel like a thick shag carpet and the body to hold on to fluid. Progesterone keeps it like a tile floor and the body to get rid of fluid. So progesterone is great for migraines, decreases inflammation. The ultimate anti-inflammatory is prednisone, right? But we can't take prednisone. We'll be a fat Oompa Loompa. How do you spell prednisone? O-N-E at the end of that. How do you spell progesterone? O-N-E at the end of that. How do you spell testosterone? O-N-E at the end of that. So you can get natural bioidentical anti-inflammatory hormones that actually make you thinner and stronger rather than fatter. So progesterone gets fluid off of you, makes you desire your partner.
So it does have a libido effect.
Oh, libido. Okay, first of all, progesterone gets you in the bedroom. You have to be calm so you can enjoy your glass of wine, enjoy the chit-chat, and just relax.
It's the relaxing point. Okay,
yeah,
I got it. So,
because the sympathetic and the parasympathetic, sympathetic is the fight or flight, the parasympathetic, you're watching the sunset in Hawaii and you feel like $1,000,000.
Okay, so it's got a anti-anxiety, relaxing, calming effect so that you can get into the mood.
But you got to remember breast, uterine, ovarian cancer prevention. It helps osteoporosis. It helps too many for me to list right now.
Oh, and you're preaching to the choir. I'm on 400 milligrams.
Oh,
well,
good.
I think we started with 200.
Probably.
Because I probably had none. And I wasn't quite sleeping through the night all the time. And my stress level was quite high back then. But then when we hit 400, and so I tell my girlfriends all the time, you might want to ask your practitioner to up your progesterone because you're still not sleeping.
So unfortunately, progestin causes blood clots, heart attacks, strokes, cancers.
What is progestin?
Progestin is what the practitioners give as progesterone.
So
and
it's
a
not
drug.
bioidentical. It's
not bioidentical. It's a drug. And if you draw a woman's progesterone level on progestin, it's still 0.
So why are they giving it?
That's a drug company's making money.
But aren't they making money on progesterone? That's still prescription.
Not necessarily, because it's bioidentical. It's old. Anybody could make it. Number one. Number two, the most common hormones are Premarin, which is equivalent, horse urine.
Yeah,
from
it's horse
pregnant
urine.
mares.
Horse urine. You're taking horse urine.
Horse urine and progesterone. And when they did the studies, they had to stop them early because the people in the progesterone wing were getting cancer, heart attacks, and stroke.
On the
progestin.
On the progestin.
Yes.
Not progesterone.
Not progesterone. So the practitioners and the pharmacists look at 400 milligrams of progesterone and says, oh my gosh, you're going to get a blood clot and die. No, 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 no.
They just clump those two together like they must be the same type of thing. Like the doctors, or the common misconception, I guess I would say, is that progesterone and Premarin are the same thing, because they're not.
No, 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 no. Yeah.
And so they think that having a high dose of progesterone is going to give you.
It's going to cause you heart attack, stroke, because the studies showed that on progestin. Right. They're not the same.
But they're not the same.
It's just like saying a 13-year-old girl who's getting her first menstrual cycle, whose hormones are brimming, that she's going to get a blood clot. She's not.
Right, because she has naturally tons of progesterone. Natural
progesterone is what we give people, even though they get it from CVS. Yeah. I can't understate calm sleep, because you go into deep sleep, you can make human growth hormone from your estradiol.
Right. You also drop your cortisol.
Exactly.
So there's a huge thing, and it's also the timing of when you go to sleep. What I was reading, and I try to share this with my women clients and friends, is that you actually have to be sleeping by 10:30.
Wow.
You get the highest return on investment for the cortisone, because we're all worried about the belly fat and our bodies start changing, but that's something natural that you can do. Now, the progesterone for me allows me to go to sleep, and it's not always 10:30, but I've tried to get into a better just daily cycle.
Right. And remember, with cortisol, naturally, cortisol is like a hockey stick. It's highest in the morning, lowest in the evening. In the morning, we're supposed to get up, hunt, gather, but it goes down throughout the day. So when people check cortisol levels, it should be saliva at 6 a.m., noon, 6 p.m., and midnight.
So those are the most accurate times, and then you can see what's going on.
Otherwise, you can't go into the lab to get drawn 4 times. So we do saliva.
And do some doctors actually want that time study of your cortisol?
You have to. Otherwise, you can't adequately assess it.
Okay.
But I don't know, 20% of my patients say I have too much cortisol and all that. I said, let's fix your hormones first to turn off the fire that you have going on.
Well, because it might naturally reset
itself.
Not
might, will naturally reset. And when you see me in 4 months, if you're still feeling this way, then I'll give you the order for the spit, because right now it's going to be high and I really don't want to treat it.
Okay. Well,
too much cortisol, the way the general medical community does, is gives people drugs. Mm-hmm. Well, you didn't take care of the cause. I don't want to give them a drug.
No, not if you can't help that. That's why I love your philosophy, and that's why you're kind of my primary right now. And yes, if something goes off and I need to go out, but it's the mindset and the mentality and thinking it all the way through.
Sure. And once again, if you get into the therapeutic ranges of progesterone, now some women may be a little low and I sleep great. I leave it alone. I don't raise it. Some are a little high, because if you take too much progesterone, you don't want to get out of bed,
Sure.
Which I suppose for some people is good, but for the majority of us, we got to get to work or get the kids out.
Sure. So that you would look at symptom dependent upon how they're doing.
And how they're doing, yes.
Okay.
Yeah. I mean, look, I just said 10 to 20. A woman can come in with a 5 or a 6. How are you sleeping? I've never slept like this even when I was younger. I'm not touching it.
Right. Well,
I'm not going to treat the lab. I'm going to treat the patient.
Common sense.
Yeah. Good.
Are there any contraindications to progesterone, giving progesterone to women?
That's a very good question. One contraindication would be if a woman has had breast cancer, because progesterone, some of it goes to estradiol. And if once again, their oncologist doesn't understand it, I'm not going to give her progesterone. So that's the only contraindication. Even though it prevents her from getting breast cancer, the general medical community, once again, lumps all the estrogens into one.
Mm-hmm. And then here I have, if you already have active liver disease, which you wouldn't find usually.
No way. You can take as much as you want.
Really?
Yes.
Oh, that's so interesting.
Well, because it's not a drug. So, no.
Yeah, I don't.
Contraindication.
I have lots of notes on this section because I had to educate myself on the specificities. Okay, let's go back to estrogen for 1 second.
Sure, estradiol.
Well, I want you to explain to everyone that yes, there's 3, but estrogen is typically just, they say estrogen. They don't break it down into the 1, 2, 3.
Yeah.
And I talk about, I think it was just this last year, I decided to go on Estradiol because I was doing some research on osteopenia and how it helps with bone density. And as I'm getting older and I'm not lifting weights as much as I should, that became a concern. What are the benefits of estradiol?
Estradiol increases good cholesterol, decreases bad cholesterol, fewer osteoporotic fractures, decrease in colon cancer, increase in circulation throughout the body, so it prevents heart disease, Alzheimer's. Women on estradiol, I don't remember a recent study, like 60% reduction, don't hold me to that, in heart disease, because once again, it releases nitrous oxide. Men, the number 1 place for testosterone receptor concentration is our heart, because it can convert to estradiol, releases nitrous oxide. Number 2 is our brain, nitrous oxide. Number 3 is our bones. Number 4 is our muscles, tendons. 5 is our fat cells. 6 is below the belt. It's the estradiol that causes us to have the sex drive, and it's the estradiol that gives a man his erection through releasing nitrous oxide. 90% of the men I get are an estrogen blocker if they're from another doctor. And they just made a medicine, which is testosterone with the estrogen blocker together, that a lot of these doctors are giving, but you just took all the anti-aging effect for testosterone out, because in every population in the world, the ones with the highest amount of hormones, specifically estradiol, live the longest and have the better quality of life.
Wow.
Human growth hormone and nitrous oxide production. You get all these nitrous oxide drinks or whatever, nothing does it in our arteries like estradiol.
Okay.
Okay.
So estradiol is bioidentical.
Yes.
What is a non-bioidentical version of that women are being misprescribed?
No, the horse urine, the Premarin. That's the only other one.
It's the only other one.
Yeah, which is mainly Equilin. It has a tiny fraction of estradiol in it. Okay. And that Equilin will take away hot flashes. And that's all doctors care about is hot flashes. I care about keeping them healthy, cancer-free, and open arteries so they don't get the number 1 cause of death and disability, which is cardiovascular disease. Because the arteries are open, they're not shut down. Now, you got to remember testosterone, though, too, because when it comes to bones, progesterone and estradiol lay down bone. Testosterone makes it thick, strong, like a man. So if you look at a thin woman at 80 years old, she's hunched over, osteoporotic, has lost several inches in height. If you look at an obese woman at 80 years old, she's hairy, she's horny, and she's standing up straight. Why? Because she made testosterone in her fat cells all her life. Obese women make testosterone in their fat cells. Obese men make estradiol in their fat cells. So obese men get boobs like a woman. Obese women get a beard like a man.
Wow.
But their bones are strong.
Okay.
You know what I mean?
Yeah.
So I'm segueing into testosterone. A woman needs testosterone. She doesn't have flabbiness and muscle weakness, poor muscle tone, poor energy or stamina, lack of coordination and balance, lack of sense of security. She's scared all the time. Indecisiveness. Do I wear the black shirt or the blue shirt? And no sensation above or below, no desire, no sexual fantasies, and no orgasms. So progesterone gets you in the bedroom. Testosterone makes it alive down there. Men are born with 1 lane. We can't pee. Women are born with 5 or 6 lanes. They can't hold on to their pee. Testosterone helps you hold the urine. So when you cough, sneeze, jump rope, you're not losing urine. You need the testosterone and estradiol to give it life down there.
Well, and is that also for the tone and elasticity of the muscle?
Oh, my goodness.
The pelvic floor?
Oh, estradiol vaginal cream is a godsend. You shoot it in there, it's no longer itchy, not painful, and you have life down there.
Does it help rejuvenate the tissue also?
Oh, yes. Okay. But you don't need that once you have a therapeutic amount of your patch, because you're making estradiol that's covering that. like you were when you were a teenager.
So do you have a preference of transdermal versus cream versus the oral pill of estradiol?
Sure. Estradiol, it's better to be transdermal, either a patch or a cream, and it's covered by your insurance. And the patch doesn't come off.
So I have a question, and this is actually for someone that had asked me about this. One of my friends is, we were actually having the hormone talk over dinner one night, and I said, why aren't you on estradiol? And she said that her doctor refused to give her estradiol because she was a smoker.
So progestin, if she's a smoker, increases chance of blood clots. Many years ago, it's been disproven the oral estradiol may increase the chance of blood clots because it clumped it together. Transdermal does not.
For all you women who spoke and your doctors are saying, no, I can't give you, they're thinking of Premarin. You could self-advocate and do some research before you go in. You could ask for a transdermal estradiol.
Perfect.
It hasn't been seen to increase blood clotting.
No, it's just like saying a 12-year-old's going to get that.
Right.
So how do you know the proper dose?
Okay.
The patch and the gel, 0.025, 0.0375, 0.05, 0.075, 0.01. So 25 cents to $1. The cream has up to $1.25. I'm never happier than a woman who's got the most severe hot flashes, debilitating hot flashes in the world, because she can tolerate more estradiol, so she's going to have more nitrous oxide, she's going to live longer. A woman who doesn't have any hot flashes,
I don't have any.
I give them the lowest dose, because if I give you too much, your breasts are going to grow cup size and your nipples are going to be tender. So it depends. I start usually at the bottom for women who haven't had a lot of hot flashes. And the ones who have had severe hot flashes, I start in the middle and work my way up. I tell every woman patient who has hot flashes, if you're still having hot flashes in a week, I want you to call me. Maybe 20% do, and I raise it. This is an interesting tiny little sidebar. If you look at little children, they all look the same. If you look at old people, they all look the same. What separates how we look is our hormones. So once Chrissie got her menstrual cycle at 12 and a half years old, you got your cheeks, your cheekbones, your lips, your curves. When John got his testosterone, I got my cheekbones, chin. So if you look at a woman and she's more representative of a woman, look at a man, he's masculine. Men who have chiseled faces had more testosterone growing up. There's certain ethnicities in men who have round faces. They didn't have very much testosterone growing up.
Do you think some of that's hereditary or world population?
Also, world population. They're not doing anything wrong. It's just where they were born and their DNA. Yeah. So what I'm trying to say is, if you want to spring in your step, if you still want to look good, still want to be in the game, even though, you're married with children, you're not in the game, but you are if you're hormonally sound. And people are attracted to you. This person is somebody I want to be affiliated with, because you're more a woman or more. That's
not even just romantic, because the studies have shown that people who are healthier, thinner, prettier, fit, subconsciously, people want to do business with. Subconsciously, people are drawn or want to be that person's friend. And I don't know what that is. I don't know if it's a frequency energy thing or if it's a little bit like, oh, that person takes care of themselves. I don't have any research in front of me that.
It's logical what you're saying.
Yeah. Right. And like-minded or lifestyled people will tend to draw together. Do you have anything else you want to say about progesterone or estrogen, estradiol, rather, as far as general knowledge?
Of my patients, I would say 1% spot. If I give too much estradiol and not enough progesterone, a woman's going to continue to have periods, which is unacceptable.
No, if you're in full menopause, though. What if you're in peri and they're
peri? Sure, absolutely. Peri, a woman makes estradiol, doesn't make estradiol, makes us. So anyhow, she rides a roller coaster. I give her progesterone to smooth that out. The minute she gets a hot flash, I give her the lowest amount of estradiol. Because a hot flash is different for you, different than my wife. Because once you go below a certain threshold of estradiol, your body starts to react. So the perimenopausal women, I don't touch the estradiol. I don't care what the level says because she's like this. It's not reliable.
You know what you told me when I went in? When I said, why is my estrogen so high? And you said my ovaries were making their last stand.
Because they make too much and they're not enough.
It's that last stand and then they're...
A diabetic, before they need diabetes treatment, they're hypoglycemic. Before the pancreas goes out, it overproduces. Interesting. I don't remember that.
I just thought it was cute. I was like, oh.
Yeah.
But
no, so those three have to balance for bone health, for well-being, to be able to work 12 hours a day and go to the gym afterwards. You can't do it without that. And once again, you need progesterone to go into deep sleep, estradiol to make human growth hormone, because that rounds everything off. Okay. Now, thyroid.
Yeah, let's talk about the thyroid, because I got a lot of notes on this.
Thyroid, you have to look at free T3.
Yes.
And it has to be upper 1/3 of normal. When I was 49 years old, I started clunking out at 9:30 at night. My wife and I would stay up to 11. I checked my free T3. It was 2.7. Normal is 2.3 to 4.2. Every other doctor would say, John, you're normal. They won't even check my free T3. But I want to be near 4.2 because I've got too much to do. I want to be thinner. Thyroid increases cardiac output, improves muscle contractility, increases the efficiency of the heart, of the brain, and most importantly, turns down the cortisol because I have my own natural energy from my thyroid that I'm taking from a pill.
So your body doesn't have to produce that.
So I don't have to produce, so I can relax. And I don't have to be stressed and irritable and angry anymore.
So I'm going to share my story about entering Dr. Alevizos' office. I was going to the OB and for about 5 years, I was gaining weight. I know this is every woman's story. And I was just in a very stressed out point of life. I have 2 kids. I run a business. I started noticing no matter how much I exercised, which was infrequent, I was still gaining weight, and it used to be that I was very fit. And if I wanted to lose a bit, I just roll back on the calories and it'd be gone. And that was not happening anymore. And every time I went in for my yearly, I would say, something's not right. I don't feel okay. I'm gaining weight. I'm exhausted, and they would say, well, your labs are in a normal range. Your cholesterol's a little high. You could lose a little bit of weight. And I said, you're not listening to me. That's what I'm saying. I can't lose the weight. And so finally, Marva, who is on my What the F segment, said, I found this great guy in Irvine. And I said, I'm going. So I made an appointment. I got my blood work in. I march in and he looks at it. And I have to say that I was almost 30 pounds heavier than I am right now. And this is probably 4 years ago. And there was a lot of stuff going on in my life. And the first thing he looked at was my thyroid and said, oh, and nobody at the OB, and maybe I didn't know to ask, explained to me what the ranges were. It's just, oh, you're in range. And I looked up the range and I think it's T3, 2.3 to
4.2.
4.2. I was at 2.4. And the first thing he said to me, he said, oh, well, yeah, you're in range, but you're barely surviving. You're not thriving. And I almost started crying because he was the first person that said, that is exactly how I feel. No one is hearing me, that I'm just getting by. And I feel like I'm going to fall off the cliff at any point. So I think that was the first thing that you did for me. I will tell you that I think you saved my life then.
Oh.
And feeling better, it wasn't just losing weight. It was being able to sleep with the progesterone and having more energy to do all the things that I needed to do allowed me to actually do a lot of deep reflections and make some changes, positive self-nurturing changes in my life that I needed to do. That's kind of why this podcast landed now too, is because I feel like I found this place of peace. But I'm not sure I would have been able to get there mentally unless I had met you. So
Nice.
You actually did change my life. And so I will forever be grateful for that. So that's my story. But I do want to talk about okay.
Pretend we didn't have a blood work. Those of you listening at home, you haven't gone for blood work. You think your thyroid is low. How do you prove it? We need objective evidence, and blood work is objective evidence, not how you feel, it's what we see. What I want, before we had blood work, what I want people to do is get a digital thermometer 3 days in a row. Before you get out of bed, start moving around and producing heat. Take your temperature. If 2 out of the 3 days it's 97 or less, you're hypothyroid.
Interesting.
So we had that.
Okay.
Then we discovered TSH, thyroid stimulating hormone. That's our brain tasting our bloodstream, sending down a signal, say, make thyroid, or I have enough, or don't make thyroid. Then we discovered T4. Oh, this is the storage form of thyroid. There's not a single T4 receptor in our entire body. And the doctors out there are giving Synthroid, levothyroxine, which is T4. And as you get older, it's not converted to T3. And if you're under stress, the T4 goes to reverse T3, which shuts down our metabolism. Why? Why under stress? Well, the buffalo didn't come through, so the caveman had to have low metabolism so it can hibernate for the next month when they're supposed to come through. So T4 can go to reverse T3, which binds the T3 receptor and shuts down the metabolism. So that's T4, and that's most of the thyroid medicines out there, the synthetic ones. There is a synthetic T3, but you have to take it 3 times a day. Who wants to do that? So our bodies naturally make T4 attached to T3 so that quick-acting T3 can last 24 hours. So Armour Thyroid, NP Thyroid, Nature Thyroid are bioidentical T4 attached to T3. Now, they are ground pig thyroid. It's identical to the human one. So my Muslim patients or my very devoutly Jewish patients, the main pharmacy I like to use, they will make bioidentical.
So they'll compound them for them.
They'll compound it for them. It'll still be bioidentical, but it won't be from a pig.
Okay. Yeah. I'm on Armour Thyroid.
Yes.
That is ground from a pig that's, I won't say equal to, but does the same job as having them compounded. But you do have the option to go.
You do have the option. It's just a little bit more expensive to compound it.
Sure.
If you have something, there's something wrong with pig. And the thing is, most doctors check a T4 and give you levothyroxine, and the TSH is low because you have plenty of T4. You look at the T3, it's rock bottom because you have to supplement what the body was supplementing, not just half of what it was giving you. You got to give it the other half.
So when you look at T3, that's what your body uses. That's the active
Correct.
That
T4 is the food in Costco. T3 is what's on the dinner table, what we're having now.
Right. Okay. So that makes sense. With the T3, I just want people to understand what their doctors seem to be looking at versus what's the...
You need to ask for a free T3.
Free T3.
And you asked, may I have a copy for my records? I want you to physically look at your T3 and make sure it's upper 1/3 of normal. If it's not upper 1/3 of normal, it's normal for a 40-year-old or a 62-year-old. Yeah, you're at the lower end of the range, but we don't have to accept that.
Right. You can be at the optimal 1/3. And
like a youthful person,
exactly.
Not like a 60-year-old or a 40-year-old.
Right.
You know? But that's not what they taught us in medical school.
It's so true.
Yeah.
It's really important that if your T3 is low, even if your TSH and your T4 are normal, it's the T3 that makes the difference.
Correct. So a good, I would say half of my patients, TSH is below the normal range. And their doctor will look at it and jump up and down. Just order the correct labs and look at the correct labs.
And I also want to point out why free T3 is so important. So I went and looked up, it's your metabolism, it's your cognitive function, it's your mood regulation, heart rate and rhythm, body temperature control, hot flashes, the gut mobility, and hair growth and skin health. It's so important. And I think it's very overlooked now that I've done my own research on what regular doctors are looking at and what they're telling you need, and bioidentical versus the synthetic versions.
And how many women say, doctor, I'm losing my hair?
Right.
That's low T3.
Right. Yeah. So I just want you guys to be aware that those symptoms, some of the mood regulation, some of the hair loss and so forth, because, you see all these beauty trends online and they're always trying to sell you some oil for your hair or this.
Sure.
You got to go to the blood work first. You got to go find out what your T3 is first. And it can be an easier fix because your body will naturally start to regulate all those things if it gets a little help.
So if you don't have adequate thyroid, you're kicking out cortisol and you can't sleep. So people think too much thyroid, you have too much energy, you don't sleep. Correct. Not enough thyroid because the stress hormone, cortisol, and making you fat too, you don't sleep. So you got to turn this off by having thyroid so you can go into deep sleep.
Okay.
Okay.
That makes sense. Let's talk about testosterone.
A total testosterone level in a man is not valid because we men peak at our testosterone at 25 years old. At 30, something evil happens. A sex hormone binding globulin, SHBG, goes up. It binds total testosterone, so there's less free testosterone. So a man, testosterone range 250 to 850, could have a testosterone of 600, and his free 46 to 224 could be 30. Where his own private doctor says, "You're Superman, get out of my office," and you look at his free and it's not there, so they have to know what to check. Mm-hmm. Because as we get older, that blocker goes up, and once I put a man on testosterone and he starts making human growth hormone from the estradiol, then the blocker starts coming down and starts aging in reverse. So it's that important. And a man needs only 3 hormones: the vitamin D, the thyroid, and the testosterone. Women need the estradiol and the progesterone as well.
Okay. Can you tell me how the belly fat, particularly, how
Sure.
does the belly fat impact testosterone and
Sure.
estrogen in men?
Wow. Okay. So a man with belly fat will aromatize testosterone into estrogen, the estradiol, which in a way it's good, but too much, you get boobs. So if my male patients are 320, 350 when they first get to me, I will put them on an estrogen blocker so they don't get boobs, but they're in a very short leash, only for a very short time until I get their weight down.
Okay.
Yeah. And then they no longer need it. What about my estrogen blocker? No, you don't no longer need it. I want you to make human growth hormone because they're making tons of it because of their fat cells.
So you might try to bring it down.
The estradiol, yes, to
Right.
a reasonable range, so I don't give them man boobs.
Right. And then up the testosterone and let it try to level itself
exactly.
out.
Because when they go on testosterone, they lose belly fat because testosterone burns belly fat, as does human growth hormone.
Do you find that the people who have the visceral or the belly, that they tend to be more estrogen dominant?
100% yes,
Okay.
for women.
Or what about men?
Okay, that's an obese man. Only men who aren't obese, they start looking like a pear due to lack of testosterone.
Okay, so that's
Testosterone in both a man and a woman will give you a V. Chest, shoulders, arms, back, biceps, triceps. So if you don't have testosterone, the belly you're referring to, it's due to lack of testosterone that they look like that.
So what would tend to make a man more estrogen dominant as they get older?
Boy, this is a huge difference. I want a man to be estrogen dominant to make more human growth hormone. Huge difference than a woman.
Okay.
Women have so much more estrogen than a man does. I want them to have estradiol to make human growth hormone. And I don't give them enough testosterone to give them man boobs. Because remember, we stay within the normal ranges. Mm-hmm. See, where testosterone got a bad rap is the anabolic steroids. Anabolic steroids are to make you big and strong. They give you liver failure, kidney failure. They make you psychotic. You're not making human growth hormone, which keeps you thinner. They make you a big blob, but some people like being a big blob. And that's where people have gotten into trouble with heart attacks and strokes and blood clots because they take superhuman levels. I've heard some of the old MMA fighters having a testosterone level of 20,000 where the cutoff is 800. Mm-hmm. Those people need to donate blood, otherwise they're going to get a blood clot and die. Those people need to be on an estrogen blocker. That's why people are confused.
Okay.
Because they're taking superhuman levels. And they look superhuman, but it's not healthy.
And that is not the same as when you look at a man's blood panel and you look at their estrogen and you look at their testosterone.
I don't look
D.
at a man's estrogen because I want it to be higher. I don't want to freak him out.
So we don't go over it. Okay. But all right.
If men ask me for their estradiol level, I will absolutely order it.
Okay.
And if it's a little bit high, I go, good, I want it that way.
Right,
And by now they know me, by now they feel amazing and they believe what I say.
One of the other things that you look at in both men and women, vitamin D3.
Vitamin D3 of 30 you need for bones. 53 has 75% reduction of all cancers combined. In a woman, vitamin D is 65, 67% reduction in breast cancer. We all need to be 70 to 100. Over 150, you get toxicity, but I've never seen anything more than 110. So 70 to 100 so we don't get autoimmune diseases. Populations that live near the equator don't have rheumatologists. Rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, Crohn's disease, Hashimoto's, autoimmune diseases, because we're in the sun. But now, even though sunny Southern California, we all need to supplement. It decreases cholesterol, it decreases inflammation, diabetes, chances of arthritis, whether it's osteo, which is garden variety old people arthritis, or rheumatoid, which is very debilitating. That's all vitamin D.
So I've heard the 5,000 a day. I've heard some take 10,000 a day, depending on who they are. But is it true because it's something it absorbs, it's always decreasing no matter how much you fill it up? I've also heard to take 30,000 unit booster once a month on top of the 5,000. What are your thoughts on that?
So each vitamin D we take lasts 2 to 3 weeks in our system. Okay. If my patient's vitamin D is low or in and around 30, I prefer to give them pharmaceutical grade, which is 50,000 units, one pill once a week, lasts 2 to 3 weeks in there. It's absorbed better, vitamin D, if you take it with a meal, or if you take it on an empty stomach. Buy vitamin D, 5,000 units with K2.
Now, the prescription grade, 50,000 units.
Yes.
Does it have K2 in it?
It doesn't. So I tell people to take it with a meal. Even if they don't, it's good enough, and they get.
And so if they're taking their own supplements, should take it with the one that has vitamin K in it?
If they're taking it on an empty stomach. So if you come in and your vitamin D is 20, and you take 5,000, if it's a legit 5,000, for every 1,000 you take, it'll go up 10 points in your lab. How convenient. So if you take 5,000 units and you're at 20, when you get your blood test next time, it should say 70. Otherwise, that brand is no good.
Oh, that's a good little tester.
So I've seen this over 100 times. The Costco Nature Made 5,000. If you're 20, you're going to come back at 45. So it's around, it actually is not 5,000, it's 2,500.
So
but at least there's something in there.
But it's not quite as optimal as other quality brands.
And if you go to one of these reputable places, so you pay $2 more a month, you just get the legit one. Now, high noon in the sun in the summer, head and neck in the sun for 20 minutes, that's 1,000 units of vitamin D.
Per day?
1,000 units of vitamin D that you just made, that's going to last 3 weeks.
Okay.
Naturally. High noon, a woman in a two-piece, a man without his shirt, 20 minutes, 4,000 units. The entire body in a swimsuit in the sun, 20 minutes, high noon, that's 8,000 units. So that's how you can get it naturally if you wanted it.
Sure. Are you a fan of sunscreen or no?
Sunscreen blocks 99% of the vitamin D and also 99% of the sun's harmful rays. For you and me, I'm a fan of, let's spend the first half hour without the sunscreen and get some vitamin D, then put it on after. Okay? Yeah. So I think we need some vitamin D. So when our skin turns pink, it's anti-aging. If it turns red, it's pro-cancer, pro-aging, pro-wrinkling, and all that stuff.
Right. It's okay. Red is damaging.
Yes.
So first 20, 30 minutes out in the sun, no sunscreen.
Yep.
After that,
then put it on.
Slather up.
And unless you're blonde hair, blue-eyed, sunscreen 100% of the time. Or if you've had skin cancer, sunscreen 100% of the time, just supplement.
Just take the supplement. I have two questions that are non-hormone related as far as lab panels.
Sure.
I want you to address the triglycerides, cholesterol, right? So LDL, HDL, ratios, when a coronary artery index is indicated.
Yep.
And what is that? It's an LPA, the lipid panel that you go
into?
The
inflammatory markers.
Yeah.
I'll go into that. General overview. Since the beginning of time, we've looked at obese people's arteries or people who've had a heart attack.
Weight challenged.
Yeah, weight challenged. We cut through them and they're full of cholesterol. They're completely closed. So from the beginning of time, we're thinking it's cholesterol that's doing that. It's actually inflammation on the artery walls that causes the cholesterol to stick. So we get a cholesterol screen. You look at the total, you look at the good guys, and then you look at the LDL. I like to look at the triglycerides as well because Your regular doctor wants your triglycerides under 150. A longevity doctor says if it's over 90, you're eating too many white carbs. Let's say your triglycerides are 130. They're certainly under 150, and your total cholesterol is 220. As the triglycerides go down, the good guys goes up and the cholesterol comes down. Now, here's somebody who has a horrific cholesterol. Do I need to put him on a statin? We get an advanced lipid panel screening. A high C-reactive protein is 3 times more predictive in a woman for heart attack than cholesterol is in a man. In a woman, C-reactive protein is 5 times more predictive for stroke than cholesterol. In a man, 3 times more predictive for stroke than cholesterol.
And this isn't part of the regular blood screening panels that we do.
You got to order the special panel. Now, why have we never heard of CRP? You know what the treatment is? Interval training, exercise. So the drug companies have no interest in it. So you're going to get on this advanced lipid panel, you're going to get the C-reactive protein. If that's low, you can tolerate a higher cholesterol. Then you look at the lipoproteins. The lipoproteins A, lipoproteins B, those are responsible to form the plaque, the hardness of the arteries. If those are low, we're done. I don't care what the cholesterol level is. But if the C-reactive protein isn't quite right, if the lipoproteins are there, and so you have big fluffy cholesterol type A that prevents heart disease, or little chylomicrons that attach to the arteries type B. So if there's a mixed pattern, it's really important that you treat the cholesterol and get the LDL in and around 100. Someone who's had heart disease or has a high coronary calcium, you want that LDL under 70, and you can only get that way through statins. You can take a statin as long as you take CoQ10, so your muscles don't seize up. So if it's somebody who has a high cholesterol, high inflammatory markers, and they're near 50, I'll order a coronary calcium score. I'm getting a coronary calcium score to see how low I have to get the LDL. The LDL, once again, if they have 300 or 400, the LDL should be under 70. So over time, they can be 200, 100.
So is there ever a time where it's appropriate to do the advanced lipid panel and the coronary artery?
Absolutely.
It's sounding like to me that those should be done a little bit more regularly for more information.
Yes. If your screening cholesterol is low, fine.
But if it's high, so mine was high, and you had offered a statin, and I said, no, I don't have any of the other markers. I want more information.
Yeah.
And so we went the coronary artery index, and it ended up being 0, yay for me.
The coronary calcium score was 0.
It was 0. And then this last time you did a lipid panel, and I had big fluffy cholesterol, so you said, no statins for you, you're fine. Yeah.
Whereas a regular doctor will look at your cholesterol.
And we'd have a fight.
Oh, yeah.
Because I'm one of those who I'm going to speak up because I kept refusing to go on statins. And I was like, no, I'm going to try to lower it naturally.
But at some point, you can do a follow-up.
I'm going to look at my test and I'll let you guys know. And even with the coronary calcium score, when I went up there, they're like, oh, your insurance company hasn't approved it yet. And I just said, what is it, cash? And it was $200. So I know that's a lot for some people, but that's actually not a bad rate to get more information. So I thought it was totally worth it for people who, if you could get a script through your physician and actually just start the conversations. Because I think a lot of us are just doing this to our doctors and without having a conversation about it. Mm-hmm. And you have to be proactive with your own care. With anything, I'm going to go get the information. And if I don't like the answers I'm getting, or I feel like you're ignoring me, I will probably find a new doctor, right? Well, we forget that we actually have these choices that we're the consumers, even in healthcare, and you should not settle for sick care.
I agree.
You don't have to, right?
I agree.
So that was my little blurb on that.
And also, too, your blood sugar, regular doctors want it under 100. Glucose.
Okay, the glucose.
But longevity doctors like it 90 or better.
90 or better.
Okay. BUN, blood urea nitrogen, our kidney, the cutoff is 24. Anything over that, you're dehydrated. A longevity doctor likes 15 or better. So there's such a thing as normal, and there's optimal, but you doing lifestyle changes, you're exercising, you're eating right.
Well, those are the foundations.
Yeah.
But also I did a lot of work on eliminating some of the stresses that I could control, or even perspective shifts so that the perception of the stress isn't quite so high. Some major lifestyle stuff that happened, which is
Good
great.
for you. Congratulations.
And so part of the reason I did this podcast is because I do want to share it with other people. You know how many people I've referred to, right? Like
a lot.
Anybody who's having problems, that just say, go.
This
go
a
see
labor of
Dr.
love
A.
for you, labor of love for me. You know what I mean?
I want everybody to feel healthy. I felt like such crap for at least 10 years, Dr. A. And when I was in high school and through my early 20s, before I started having kids, so really like 30, I was
a competitive soccer player, right?
I played competitive soccer. I played basketball. I used to mountaineer. I rock climbed, spurring me to, I've got to decide what kind of strength resistant training. I used to love plyometrics. My knees aren't quite what they used to be as far as some of the surgeries. So I don't know
Plus you're jarring your spine.
I know, but I love them. So we'll see. I'm going to research some stuff, but you have inspired me to look at what I want to do to add resistance training.
Good.
Yeah. And but I looked at the sleep, I looked at the stress. And so you got me started, because if I had not had that help of just normalizing my metabolism, you know, and it's not the easy fix. I mean, yeah, I did start losing weight, but that's because my thyroid was so out of control that Chrissie, I wasn't even metabolizing.
One thing I need to say, 100% of people on medical weight loss lose weight. Number two, 100% the minute they stop, gain it all back and more. Number three, unless they have the hormones of a 25-year-old. So now that your hormones are young, whatever you lose and however hard you try and whatever diet you're going to be on, all you need to do is maintain it afterwards, because you will lose the weight and keep it off. You'll keep it off.
Well, that's a lifestyle change, though, too. Like it's just like anything. You can go get your stomach stapled and you can eat right through that. If you don't have the mindset, if you don't do the self-nurture in that I deserve and I'm worthy of feeling good and looking good and feeling fit, it doesn't matter what you try, it's going to fail.
Right.
So that's what I mean by the whole health concept of, you got to look at the hormonal, but you also have to look at the physical, your emotional, your mental.
Right.
Right. And really, and even your spiritual, it's the faith in your own self of being able to change those things.
Because the spiritual helps me deal with my stress. So,
of course, I think the spiritual is the base of everything. It's how you approach life. And I think having purpose is part of spirituality in a sense of it's a giving back. It's having purpose, serving. Those are all clumped into one for me, because that's what we're supposed to do. That's why we're here on earth. Is there anything else that you want to touch on?
You know, people's general attitudes towards their health, they don't have to accept not feeling right. You don't have to accept being angry and irritable at your wife and kids. You're angry and irritable because you have no energy. You're fatigued.
Do you want to tell your story about being irritable and angry?
When I was 46 years old, my wife sticks her finger in my chest and says, "You're checking your testosterone level."
Yeah.
I said, "What are you talking about? You're mean to me. You're mean to the kids. Your temper is short. You're always falling asleep on your lazy boy." So I checked my testosterone. My bioavailable 110 to 575, I was 120. I was livid because I still worked out 5-6 days a week. I had a very busy medical practice. Worked long hours, worked through the night a lot of times.
You're still grinding.
Yeah, and it saved our marriage. She feels it saved our marriage.
See men out there, or women, get your men.
And women, it's not anabolic steroids. They don't go psychotic. You want them to be productive in life. You want them to be calm.
And I think that they think that, the testosterone, you get all the mean. That's not the same.
And it could happen with bioidentical testosterone, but if you do superhuman levels, I won't allow that.
Not if you're being guided by a medical professional and you're staying within optimal, healthy ranges, everything regulates.
Yes.
Right?
I have so many patients that we're seeing other longevity. Well, why are you here? Then I analyze it, and every single time I have to make some changes, you know.
Well, but it's like Dr. A soup. Like, your ingredients are going to be a little different.
That's a good point.
It's the essence of your practice.
And I've been doing this for 34 years, so I've seen it all. And especially with women, because women are complicated. I don't know how many, man. I've had hundreds of women that come in, everywhere. And then by the second visit, they're a different person. So
when people come into your practice, do you tend to see them?
I'd like to see new patients at least one time face to face, because I can size things up. I go, this guy's sad. That one I can't give him too much because he's a little bit manic. But if they live far away or they just can't, we'll just do it by phone. I have visual stuff in my office that I could show them. It just makes me explain things better.
Right.
Yeah. So I prefer in person, but it doesn't have to be.
And then how often do you do rechecks?
Every 4 to 6 months. Yeah.
Well, and in the beginning, every 4 months, because you got to monitor the blood.
Because I got to figure out what they're doing. Now, patients will say, no, I want this as soon as possible. Okay, 2 months.
Right.
Because it takes a full 6 to 8 weeks to level out on the hormones that I'm giving you.
Oh, to see where you're at, to see if you need to make any other changes?
Because if I put you on thyroid for the first time, I can't check it in a month. I have to check 6 to 8 weeks. But if I change your dose and you already had some thyroid, I can check it in a month.
Okay.
Yeah.
Well,
all of this is very scientific and the art of medicine. Like you said, looking at a person.
Yes, it's the whole thing. And I think that when we work with people all the time, you pick up the nuances of someone's tendencies, personalities. It's not just scanning you like, oh, this person's overweight. It's not those piles. But like you said, if someone's very high strung, you're going to choose something different.
A little bit more conservative.
Correct. The treatment has to match their tone. If you talk about tone, right?
It does.
So it's the same thing with therapy. If I've got some little lady who's never exercised, but she comes in with her shoulder repair, I'm not going to do what I do to the athletes.
Right.
It's looking at the same thing, but picking the appropriate that matches with that person's current.
A lot of people come in and as I'm sitting there, they'll go, that's anxiety. And if it's in a woman, they're doing a lot more progesterone. If it's a man, I'm doing less testosterone because testosterone gives you energy. We don't want any more of that right now because you're already
feeling like your heart's palpitating. So it's the nuances, but I also think that makes you a great practitioner.
Thank you.
Is that your radar, so to speak? Those are the subconscious, unconscious things.
And I have a lot of her patients. They love you.
Oh, that's
nice.
They
love you.
Call it Chrissie therapy. I don't know. You'd have to.
No, you do also spiritual.
Yeah,
stuff.
There's some life coaching. There's some spiritual wellness, and it's on body. So it's very cool. It's very satisfying.
So you practice what we're talking about here. Which
you have to. Otherwise, I'm a fraud. Doctor, I thank you for not only demystifying hormone health, but for giving us clarity and confidence to take our well-being into our own hands.
Thank you.
Whether you're navigating midlife, all the changes, or just starting to question what normal feels like, this conversation is your reminder. You can feel better. Your body is not broken. And with the right support, someone like Dr. A, you can move from surviving to truly thriving. And that's exactly what happened to me. If today's episode sparked something in you, start small. You know how you feel. This is your invitation to begin prioritizing your vitality because you're not too late. It's not too hard. The shift begins now. Don't forget to follow the show on your favorite platform or subscribe to our Substack for bonus insights and early access to future episodes. Our shift has ended for today, but your journey continues. See you next time.